Good afternoon, everyone, and good morning to those of you who are on the West Coast. My name is Jill Kagan, and I'm the director of the Arch National Respite Network and Resource Center. I want to thank you all so much for joining today's webinar, an introduction to the Cultural and Linguistic Competence Assessment for Respite Organizations and Guide. We're very pleased today that we are able to provide ASL interpretation and remote captioning today. And as you heard, the webinar is being recorded and will be available on the Arch website in the next day or two, and you'll all be notified about how to connect to the recording. Given the very importance of this topic, we did extend our invitation very broadly, and we want to welcome those of you who are new to Arch. Please feel free to introduce yourselves in the chat with your name, your organization, and state. We'd really love to know who is with us today. And for those of you who are not familiar with Arch, I have just a few tidbits to share with you. We're funded by the Administration for Community Living to provide training and technical assistance to the Lifespan Respite Care Program grantees, to their partners, to the respite field and the public more broadly. The Lifespan Respite Care Program, again, for those of you who may not be familiar with it, is a federally funded initiative that helps states build coordinated systems of respite care services that support all family caregivers who are caring for anyone of any age or condition. Arch also provides information to family caregivers and those who assist them to help them find respite in their communities through an online national respite locator service and by linking them to their state lifespan respite care program or state respite coalition if they have one. Our National Respite Coalition is the policy division of Arch that advocates for respite at the federal level. And of course, you can connect with us at any time through our website at archrespite.org. I would be totally remiss if I didn't mention our upcoming National Lifespan Respite Conference that will be held in Albany, New York, May 21st through 23rd. I want to acknowledge our co-hosts for this event, the New York State Caregiving and Respite Coalition and the New York State Office for the Aging. We are so very grateful to them for their collaboration. The theme for this conference is Raise the Bar for Respite, which we hope reflects our commitment to implementing the national strategy to support family caregivers that was released by ACL in late 2022. And you can read more about the national strategy and about the conference and also register at this link in the slide. And I'll post the link in the chat in just a minute. Before I introduce you to our speaker, I want to acknowledge the great work that many of you in the Respite Network, whether you're a respite provider, a state grantee, or a state respite coalition representative, all the great work that you've already undertaken to engage diverse family caregivers, their family members, partners, whether you're in a coalition or in a program, in every aspect of your work to ensure equitable access to respite services. But there is still so much for all of us to learn and even more that we can do. And our hope is that you will leave this presentation today having learned the value of organizational assessment, as well as new concrete strategies that you can apply to your ongoing work to ensure culturally competent respite services. I am so very pleased to introduce you to our speaker today. Many of you probably know her. Tawara Good is the director of the Georgetown University National Center for Cultural Competence and the University Center for Excellence at Developmental Disabilities at Georgetown. She has many years of experience in guiding agencies and programs in the assessment and development of culturally and linguistically competent services, primarily in the disability field. And she and I have worked together now for several years on this endeavor, and I don't know anyone with greater insight, knowledge, or expertise on these issues than Tawara. So thank you so much, Tawara, for taking time out of your very busy schedule to talk with us about this important topic and share the new assessment and guide that you've developed for us.
Thank you so much, and good afternoon or good morning, wherever you may be. I'm going to bring up my slides now. All right. Hopefully everyone can see the screen right now. All right. Pretty long title, but we're introducing you to the Cultural and Linguistic Competence Assessment for Respite Organizations, and the acronym is CLCARO, just because it's a mouthful, and also the guide. That's a general purpose for today. I'm going to go through a number of slides with you, and also we'll pause for questions as we go along and at the end. So with that said, we're going to go ahead and get started. Whoops. So these are things that I'm not sure where my, all right. These are things that we'd like to be able to do today. In order to do this presentation, I thought that would be helpful to really give just a quick overview of what frameworks are for cultural competence and linguistic competence. Many people think of it in many different ways and just want to be clear that we're on the same page. We will list the benefits of conducting organizational self-assessment for cultural and linguistic competence. We'll share with you how the CLCARO and the guide, how they're structured, and we will engage in Q&A. So with that said, I'll advance the next slide. This slide is just showing you a lot of different terms that we see in the literature, that we hear in either the published literature or just in general conversations, also in resources going forward, that there are a lot of different terms that people use in terms of this work in this space. What I'd like to share with you is that each of these terms means something different. And so that's why we're taking the time to say, this is what cultural competence means, at least in terms of how we look at it at the National Center for Cultural Competence. Just because someone's culturally aware doesn't necessarily mean that they change anything they do in the way they may interact with families, with persons who experience disabilities, and also with older adults. Or an organization or persons may describe themselves as being culturally sensitive. That doesn't mean that they have policies and procedures in place in order to ensure that culture and language are indeed incorporated in all that they do. So we're just going to spend just a few minutes right now going through our frameworks for cultural competence. As we think about cultural competence, again, at the organizational level, we look at cultural competence basically as, first of all, whatever the organization, agency, or program is that they have to have their explicit values, and that those values and or principles have to align with the policies that are in place within that organization, the structures, the practices, behaviors, and attitudes of the people who work there. And so that we look at cultural competence in this broad, interconnected way. So it means that those organizations have to be able to demonstrate policy, structures, practices, behaviors, and attitudes that will enable people who work within an organization or program and or their volunteers to be able to work effectively cross-culturally. And it does say cross-culturally, it doesn't say cross-racially, it doesn't say cross-ethnically, because we're looking at cultural competence as being applicable to all people. Because we as human beings all use culture as our way of socialization. And so that everyone would fall under this umbrella. And I like to say that I would need to be as culturally competent in an area in Washington, DC, as I would need to be in an area in, I don't know, Appalachia. That's, not too far away from the city. So we're really thinking of cultural competence in that way. At an organizational level, this means that you have to be able to value diversity, not just say it, not just have it on a website or in way brochures or other kind of things are configured, but you have to value the diversity overall and demonstrate that within the organization. So that means whether it's diversity of race, ethnicity, gender identity or expression, geographic locale, and diversity of thought. All of those things fall under this umbrella of being able to value diversity. And the next one is being able to conduct self-assessment, which is what we're going to talk about extensively today by introducing the CLCARO. So in terms of conducting self-assessment, we're going to maybe skip over that and come back to it as we describe the tool. Another essential element is that an organization has to be able to manage the dynamics of difference. That would be the differences between staff, between communities, between people seeking and receiving services. That is part of the capacity of any organization, to be able to recognize these differences and to be able to manage them effectively. Oftentimes people will say, I put a lot of emphasis on difference. I do in many instances. However, it's not our similarities that causes our problems. It is our lack of understanding of our differences and to be able to adjust to those differences, both in culture, both in language and beliefs and practices. The next element of cultural competence is being able to embed cultural knowledge. You see the term institutionalized there. And the reason that still remains there was from the original work back in 1989, done by Terry Cross, Barbara Basmar, and Carl Dennis and Marisa Isaacs, who came up with this concept of toward a culturally competent system of care. I like to honor their work. They did the work through Georgetown. And I also wanted to introduce a new term or a different term than institutionalized, because institutionalized has such a negative meaning in many settings. Their intent was that it should be across every component of an organization. So I've substituted the word embed that's there, that we need to be able to embed cultural knowledge. And I use this as an example that oftentimes in some organizations, there may be someone who's, I'm going to say, the keeper of all knowledge concerning a particular population. And that's a go-to person. And people within the organization and sometimes within a community will go to that person as it relates to this particular cultural group. When I think about what can often happen within organizations is that if that person leaves, all the knowledge and experience walks out the door with that person. If the organization or program or agency hasn't taken steps to embed that knowledge across all components of the organization, doesn't mean that maybe this person is really excellent with a particular community, has bilingual, multilingual capabilities. It's not as if we're totally substituting that expertise. What we are saying is, what do we need to know about this particular community? How does it relate to policies and practices that our organization may indeed have? And so wanted us to really think about being able to embed cultural competence in the values, the policies, the structures, and the practices within an organization, because we all have to adapt to diversity. There are many things that stay the same, but there are things that are constantly changing within organizations and the communities that they support. So if we look at these 5 elements of cultural competence, we look at this indeed saying that they have to be at every level of an organization. I will share with you, when we look at the literature in particular, there's a lot of literature, not necessarily in the developmental disability space, but certainly in other sectors, that practices, supports, and services and care is indeed the focus. so that we see a lot about what individuals should do. The CLCARO and our work is really focusing on not just what individuals do, but what should an organization, program, or agency do. And so that means that cultural competence can't just live at the practice, the supports, the services, and the care level. It must be at every level of an organization, including the policymaking level, the administration level, individual and families level, and also at the community level. And that all of these are working together to move organizations toward cultural competence. And so again, we would then see that reflected in the attitudes within our organization or program, the structures, the policies, the practices, and the services that will be provided. So again, this is how we are thinking about cultural competence, and that's how it's framed in the CLCARO. We believe that cultural competence is a developmental process, and it occurs along a continuum, so that individuals and organizations, programs, and agencies are at different stages along the continuum. And there are different stages for a variety of reasons. Could be in terms of personnel, could be that there may be new populations. And I'll give you an example. There's a Head Start program in the District of Columbia was just exceptional, serving kids with and without disabilities in an inclusive setting. And they were really, really skilled in serving African-American children. And then there were demographic changes in the neighborhood, and the neighborhood kind of switched over to a large Latino population. So here we had this award-winning, really great early childhood program for kids with and without disabilities as an inclusive setting, not being as competent with a new population that came along. And so we look at cultural competence again on a continuum, and that we're continuing to grow at knowledge and skills over time. I'd like to quickly define linguistic competence. This is work of colleague Wendy Jones and myself. And we started to put this together when the federal government came out with the national class standards, many of which you are aware of. And so similar to cultural competence, we're looking at linguistic competence as the capacity of an organization and the personnel within that organization to really be able to communicate effectively with anyone that they come encounter with, whether that's in person, whether that's via Zoom, whether that's on a telephone, or whether or not that's via email. And we know that when we think about persons who experience disabilities and also older adults, that there's going to be a huge range of communication interests and needs. And so this organization must have the capacity to communicate effectively with the populations that they're serving. And in a way in which that communication, whatever the mode may be, is easily understood. And this may be by persons who have limited English proficiency. This may be by individuals who are not literate or have low literacy skills, either in English or their language of origin. This may include individuals with disabilities, the broad range of disabilities, and because of those disabilities, communication has been impacted. And it also includes people who are deaf and hard of hearing. And so this is how we think about cultural competence. Linguistic competence. It also requires an organization or provider or staff to be able to respond effectively to the health literacy and mental health literacy needs of populations that are served. So that this is an essential aspect, we feel, of linguistic competence, especially as we're looking at persons who are older, who have many more health needs, and persons who may experience disabilities, and along with that, have chronic health conditions and problems. Lastly, as we think about this framework, similar to the cultural competence framework, there needs to be policies in place within the organization. There needs to be structures in place, practices, procedures, and dedicated resources. I can share with you, there was a period of time when I was less busy that I volunteered to read grants more frequently. One of the things that I would note is that I would see that an organization would describe the population and may indeed include a population of people who speak languages other than English. But yet when I looked through the application, I didn't see the staff proficiency to be able to do it. I didn't see contracts with others who would be able to help with provision of interpretation and or translation services. And importantly, I didn't see any resources allocated in the budget. I didn't score those applications very high. And as we think about the capacity for linguistic competence, it is going to require all of that, including policies and procedures, and especially dedicated resources. So I will stop there. And Jill, you can let me know if there's any questions or any comments in chat that I need to respond to, but before going on to talk about the CLCARO and the guide.
I have not seen any questions in the chat, unless Marcia, did I miss any?
Nope, I didn't see any either.
All right. All right, we will now move along and to talk about the CLCARO and guide. I want to acknowledge a colleague who's the parent of a young adult with disabilities who created the design for the cover for this guide. And her name is Monica Sanjur, and I just wanted to be able to acknowledge her creativity and just the images that she brought to light in our cover design. So as you think about, why should you even think about having a cultural linguistic competence self-assessment process? Like what's the big deal about this? What we've found is that in engaging in these self-assessment processes, and we've been at this for a pretty long time, probably since 1998, 1999, in terms of doing this in many different organizations across the country. But what an assessment can tell us is the degree to which you're effectively addressing the interests and needs of diverse ethnic, linguistic, cultural, racial, and other identity groups. Because you're going to probe that, you're going to ask for that, rather than looking at everything as a composite. We will, this assessment will help determine the knowledge, the skills and interests, and the needs of staff, board members, or other organization membership as it relates to the specific area of cultural and linguistic competence. It will ultimately help improve access. These are reasons why we do it: utilization, outcomes, and satisfaction with services and supports that are conducted. It can help you establish partnerships, and I'm going to say meaningful partnerships with older adults and family caregivers and friends and community partners, all around looking at culture and language and its applicability to respite services. And lastly, we look at this process as being able to look at the strengths of any given organization or program, and also to identify what might be areas for growth. Now, I want you to pay close attention to the term areas for growth. When we first started this, and it was just a number of years ago, that we wanted to be able to convey to organizations that these are areas that may need improvement or focus. So we did not use the language deficits. We did not use the word language weaknesses, because it just, people didn't take it so very well. And as we look at the spirit of cultural and linguistic competence and anything that we're doing at a university level, we're looking at continued areas for growth. And so that's the language that we use. You will see it in the guide. Again, determining areas of growth. If we are looking at the conceptual framework for organizational self-assessment, as stated before, it's a developmental process for individuals and organizations, period. We believe that was appropriate support, and that could be a range of support in multiple ways that individuals can enhance their cultural awareness, their knowledge and skills over time. And we also know that cultural and linguistic strengths are often embedded within an organization, but sometimes they are unnoticed, not tapped, not celebrated in terms of work going forward. And so these are things that we're thinking about as you may contemplate engaging in a CLCARO assessment process. We feel that this is a philosophical construct, that if you engage in organizational self-assessment, it is an effective and systematic way to be able to think about cultural and linguistic competence. And we have these areas that are listed, things that we definitely want to probe, and that will be the values of organization, their policies, their structures, their practices, their attitudes and behaviors. Really looking at this within the organization and including the board, staff, consultants, contractors, and volunteers. And this is really very important in terms of eliciting the perspectives of diverse community and constituency groups that are served. So all of these will be part of philosophical construct. These are our constructs, and it means you may modify it, you may think about it in a really different way. But if we're talking about assessing an organization, we're going to look at everybody who comes in contact with that organization. Let's see. These are things that we try to embed in our approach. That is a strengths-based model. If you've had a chance to look at the tool, we're not, quote, measuring negative outcomes. Every item that's in the tool is suggestive of good practice or evidence-based practice. We feel that in order to engage in this, to engage in a CLCARO assessment, is that the environment has to be non-judgmental and it has to be supportive. We used to have safe there, a safe and non-judgmental environment, and we changed that because people's view of safety is really very varied. And our experience has been that sometimes when asked to engage in a self-assessment process, some individuals were within the organization were reticent or felt that they, quote, didn't know enough about it and they didn't feel safe in terms of participating. So we changed that to look at that from a supportive environment point of view. When we first launched on doing these, and this was many years ago with maternal and child health Title V programs serving kids with disabilities and special healthcare needs, some of those programs did not want to, they only wanted to look at themselves. They were very reticent to be able to have persons who are receiving services actually participate. So we are suggesting to you that it's not an accurate or comprehensive assessment if you do not involve the people who are receiving such services. And our guide and the tool gives you ideas about how to do that. We think that the results from organizational self-assessment, they're obviously very important, and that they're not to get a score. They're not to say, hey, I checked this off the list. I went through an organizational self-assessment process, but it's really to look at how do we build capacity. And we don't feel that organizational self-assessment is a one-time thing, that you may do it in year one and decide, hey, we need to do this again in 3 years because many things have changed within our environment. And then lastly, our experience with many different organizations is that they use many different ways in which they disseminated the results. They didn't keep it all to themselves. Some organizations brought in community members and constituency groups to talk about the results and to look at future planning. What can we do together? So again, these are some of our values and guiding principles for this assessment process. Okay, The CLCARO really is divided into 4 areas. Our worldview is really looking at, as indicated here on this, on this slide, is that the focus would be, what is the organization's worldview? How do they think about cultural diversity and approaches for inclusion and equity? And I would say that equity is a new term for many in this work. And quite frankly, I'm going to say it's also an overused word, and there's not consensus, especially within the disability space, in terms of what does equity really mean. And so we did our best to include some probes as it relates to equity in this overall guide, and also in the tool. It's looking at how this worldview, again, toward inclusion, equity, and cultural diversity, how does it guide how the organization operates? And then again, the organization's commitment to cultural and linguistic competence. So these are the probes that would be in that area. The next one is who we are. And this looks at the cultural diversity, and I'm saying cultural, I did not say racial and ethnic. I did say the cultural diversity of the staff, board members, committee members, and others who do the work of the organization. It looks at the kinds of training that might be required, professional development, that will be able to support the workforce, as well as others who are involved in doing the work of the organization. The next section is what we do. This is a much longer section, as you can see, and this tool is really an adaptation of a tool that we have already published and had out in the world, that has had thousands of users, and that's the Cultural and Linguistic Competence Assessment for Disability Organizations. We used that format and looked at modifying it to create the CLCARO. So these are the variety of things that many organizations may engage in, which means that in this section of the tool, you may not respond to all of them because they may not be applicable. But we looked at recruitment, education, and training for key constituency groups. And we did our best to align this with, I'm going to say, the responsibilities that come with the Respite grantees. We look at public policy and advocacy centered on equity, because that was a space where equity fit more easily in terms of things that we could actually look at trying to measure. Community engagement and partnerships, and this is with a huge emphasis on under-resourced communities overall, and racially and ethnically diverse populations. We look at information dissemination, and then the provision of direct services and supports, including continuous quality improvement. So in this section, again, which is the longest, it has probes for each one, multiple probes for each one of these areas. Okay. And then how we work. In this section, it's looking at how do you apply cultural competence and linguistic competence and equity to the structure of your organization, to the funding within your organization, and to the leadership activities. So that's a lot. We feel that the tool is quite comprehensive. And all right, are there questions or comments in chat so far?
A question just came in that I think is very relevant. Nanette would like to know, is there a guide for aging services organizations, or do guides exist for respite and disability organizations only at this time?
This guide includes aging and disability, this particular guide and tool, because it's for the respite program, and the populations are for older adults and persons with disability.
Yes, Tawara and I worked very closely to ensure that this guide would cross ages and disabilities entirely in every aspect that's addressed.
Jill, anything else?
I haven't
Okay.
seen anything, nope.
All right, so if we look at stages or ways to engage in self-assessment, what we found helpful first is to have a work group that's going to really look at the structure, how you're going to get this done. That's really very important. And sometimes that was problematic because people had multiple roles and responsibilities. And sometimes leadership did not, let's say, allow the amount of time that was necessary. So these are things that we worked on over time that would be important because people who are leading this do need time away from their routine duties in order to do this. Being able to create a shared vision and ownership is sometimes people did not share in the vision of cultural and linguistic competence. We found that to be really key and critical. Your process of collecting, analyzing, and disseminating data, part of the process. And then importantly, it's like you have all of this, but then what's your plan of action? And our guide goes through step-by-step detail for each one of these phases with examples. And I'd like to share with you just some things in terms of what we've learned along the way in terms of doing this. And I budgeted in, hopefully enough time to respond to other questions questions and comments that you may have. So in order to do this, it's time and resource intensive. Not so much fiscal resources, but the time that it will require for people within the organization to help organize, conduct it, and to be able to analyze the data and to work within communities. Now, some of this may be things that you're already doing, but we wanted to make that note. Another important step is to look at the organization's commitment and readiness before starting. Some folks jumped into the deep end of the pool and had to really abandon because their organization just didn't have the commitment, wasn't willing to commit the time or the resources to do the assessment process. We feel that the process is as important as the outcome, how you engage people, shared understanding of terms and concepts, shared understanding of what the purpose is and what the potential outcomes were going to be to help the organization. All of that is upfront kinds of things that would need to happen. And it's clearly outlined the approach for this in our guide. Our other lesson learned is to anticipate resistance. And I'm not saying this in a negative way, but it was a reality that some people just didn't want to do this. They weren't really very interested in it. As I think about our current social, cultural, and political environment in this country, that there are levels of resistance as it relates to many terms, diversity, equity, and inclusion. We see that a lot. And so really think about resistance and what you may need to do to be able to bring people on board. And I'm going to say this tactfully, to bring people on board. And then to also address some of the hard issues that may come to the table in terms of doing this work. So let's look at what the root causes may be. We've had organizations where folks would say, oh, I'm not too sure. I'm not too sure about this. But the not too sure about it was that they're not necessarily feeling they had the information to work with these culturally and linguistically diverse groups. We have an approach for that. Okay, overall, we can provide information. However, there were also organizations that said, we don't want to work with that community. That's a whole different thing. So that determining the resistance points and why would be very important, and doing so without judgment. We learned that you really have to have the buy-in of leadership to do this. Many times the people who would come to us were people on committees and people who were very invested in surveying populations in a particular way. And that they sometimes wanted to jump into it without having leadership on board. That's why we had in the guide things about getting the board on board and also making sure that your leadership is at the table because it's so very important. And lastly, if you're going to do this and take a good look at yourself, you really have to engage people external to your organization, agency, or program in the process. And you should really do that from the very start. What we found is those states and organizations that did that were surprised because those communities and their groups brought a lot of resources to the table because they were invested in having supports and services delivered in a culturally and linguistically competent way. So this is my last slide, and it's just quotes. I like quotes. And as we continue to move toward serving the diversity of people, and that would be all of the people who live in the United States, territories, and tribal nations, that indeed that we have to take culture and language into consideration. And it's not just for the people that we support and serve, but it's also within the functions of the organizations that we have. And so I just pulled up this quote: culture does not change because we desire to change it. Culture changes when the organization is transformed. The culture reflects the realities of people working together every day. And we think that the CLCARO would indeed be a process to help organizations begin to achieve these goals. So I will stop here. And I'm happy to go to questions and answers before having a word from Jill.
We did have a couple of questions come in to Wara. Sarah would like to know, is this tool designed to measure change over time within an organization?
If you administer it more than once. All right, so that when you are taking the CLCARO for the first time, you're seeing this is where we are because this is the first time you've done it. If you choose to do it again in 4 years, to see if you've made some of that progress based on what you come up with in your action plan. You may have new staff, you may have changing demographics, you may have more or less money. So each time you engage in it, that you should be able to mark and compare over time.
Thank you. I think that was a very important point to make. So thank you, Sarah, for asking that question. Cheryl wants to know, have any respite organizations used this assessment tool? And what benefits did they realize?
This is brand spanking new.
Yes.
And we're introducing it to you for the first time. I have indicated previously that we adapted it from a tool that we've used that looked at disability organizations and have been very successful with that. So no, not that I'm aware of that any organization has used it yet, but we certainly did get information from respite providers as we came up with the items.
And we're hoping that all of you out there will use the tool and then provide us with your outcomes so that we can monitor how successful it is. Cheryl has a follow-up question. For organizations with limited resources, is it ever okay for them to take a targeted approach to service delivery?
I'm not sure. Is this about the CLCARO or the organization's approach to service delivery? I'm not clear on the question.
Cheryl, you can feel free to come off mute and clarify if you'd like.
I just, this is Cheryl Donnell from Nevada. I was just commenting or that there are organizations that are very small in staff, in resources, and that they may have taken a targeted approach to delivering respite in a certain area, community, for a certain group. And so there's a sense of, is this going to stretch us beyond our capacity if we're trying to hit such a broad stroke of, in a diversity picture. So I'm not sure about what you were referring to. I didn't quite follow what you were confused about. Did that help at all?
Yeah, I was confused about whether or not you were talking about the CLCARO and how that can look at a diversity of populations versus whether or not you were asking or stating that this is the way you're currently doing business. And I didn't get the and what part. So you just shared that with me, I think, in terms of what you're calling targeted population. I might call it a population of focus. We've learned, again, to change some of our language. Many communities resent the language being targeted. They find that language harsh, offensive, and sometimes associated with violence. And so if you have a population of focus, and you know that this is the population of focus, then indeed, when people are staff are completing the organizational self-assessment, when you're doing listening sessions with people who receive services, then it's very clear that that is the population of focus that you're talking about. So that you're able to gain information based on saying, we're only looking at this cultural group or this racial group overall. Does that, am I responsive to your question now?
Yes, thank you. I just think that sometimes we think we would like to be bigger, we would like to have more staff, we would like to have more resources, and sometimes that's not part of our reality at where we are right now today. And so I just wanted to, make sure that this tool is allowing us to identify where we are strong and not have to say that that's wrong. It's just that it may be that as we are looking at serving more and more with the resources that we hopefully will have, that we have a tool that will help us identify where we can move next, where we would be able to build some strength. It seems like a lot of work that needs to be done before this tool is just relationship building. And building those bridges to communities that may have fallen in our underserved or underserved communities, neighborhoods, areas, geographic locations. And so that is when it will be a really valuable tool. But those relationships will probably need to be part of the framework of future development, well beyond being able to implement any new service delivery. Would you agree?
You said a lot, and I was trying to process all of that. I think a couple of things is that you serve who you serve, you have the resources that you do. I think the tool can be helpful to you, because just because you serve a particular population, and I don't know how you're defining that by race, ethnicity, or other factors, it's important to hear from them whether or not they're receiving supports and services that are meaningful to them and that honor their culture and language. So that's number one. I think the other thing to really think about is that even if you are serving a particular group, I'm going to say Latino population, it would be an error on our part to assume that all people within that population group think and need the same thing. So that this is a way, even with a single racial ethnic group, that you're able to discover the interests and needs and preferences of those groups.
Okay. There is another question from Landria. If you have already done the background work to assess your organization, how do you identify a consultant to guide the process?
Good question. There are a lot of people who've hung out their shingles under the rubric of diversity, equity, and inclusion. I would want to know what their experience would be, not just in diversity, equity, and inclusion, and or cultural and linguistic competence, but also older persons and persons with disabilities, because that is your organization, that is who you're serving. And so that just because one knows, quote, diversity, equity, and inclusion, doesn't mean that there's a natural match between that and what we're talking about in terms of respite services. So I would want to go about finding someone that has those skill sets.
I'm not seeing any other. Oh, no, here comes a question now, I think. Megan is responding to the last questioner saying, I'm a huge fan of Denisha Thompson from For Impact Consulting. I guess she's offering a consulting person. Okay. Any other questions? You can feel free to come off mute as well if you prefer to ask it live rather than in the chat.
Tawara, this is Sarah from Idaho. Thank you very much for your presentation. We recently had our statewide Caregiver Alliance meeting, and we asked for feedback about, directions we should be taking, and came to realize that we got some great feedback, but our capacity is quite, narrow or limited. And so we came away from that discussion thinking, maybe our role is we're the connector of two agencies that do have the capacity and mission and focus to serve specific populations. One that came up to was the deaf population with hearing deficits. And, I'm wondering, in kind of setting the frame for the message that you send out along with this survey or this tool, how defined should you make that, I don't know, your culture you're speaking of, I guess. I'm struggling with, you can't do it all. And I think it's similar to the conversation that the person from Nevada was having. How do you frame this so that you're getting the information that will guide your work in whatever limited population you may actually be able to serve?
So I think you'd have to focus on that limited population.
Yeah.
Okay. I mean, I would think that that's what you would need to do.
Mhm.
Like, we just can't make assumptions that because people are from the same racial group, let alone geographic locale, that there are always similarities in experiences and needs and their preferences and needs as relates to such services. I mean, it's also, this is looking at organization, but these are also things that when you're doing evaluation, assessment of the quality and how folks receive supports and services, that these are things that you're probing for always, because we're all cultural beings as humans. So I want to know whether or not you address my cultural needs, whether or not I'm African-American or non-Hispanic white. And I think that that's a really, really important question, not a question, but a really important statement. Is while ACL has put emphasis on, as well they should, under resource and underserved communities, that cultural competence isn't reserved only for people from racial and ethnic groups other than non-Hispanic white. And that happens a lot, that people will think that, oh, if you're talking about cultural competence, it's about this group over here or those people over there. It's not about us as non-Hispanic white people. So as I indicated earlier, that one would need to be as culturally competent and linguistically competent as we described it. So it's not limited for interpretation translation services to anyone in your geographic locale.
One more question just came in. Does this assessment lend itself to identifying a service delivery model that is flexible in crafting respite around individual caregivers to take into account how they can culturally receive and benefit from respite?
So I think that it measures things. I think that results can help you decide what kind of business or practice model that you want, because it's looking at many, many different areas. And that based on the results, that it can help you decide these are areas that we need to focus in more. And there were a number of categories. So part of that may be training and professional development or coaching and mentoring, and that there may need to be an emphasis in that particular area.
I hope everyone's questions were answered. We are coming upon the hour, and I did want to take a minute for some closing comments, and especially I want to thank our ASL interpreter, Anne and Katie, our remote captioner, for their immense assistance today. And I also want to thank Marcia O'Malley for providing the background Zoom support that I would be lost without. So thank you to all of you. And especially thank you so much to Wara for really taking the time out of your very busy schedule to talk to us today about this important topic and share these new, spanking brand new resources for our respite network. I did want to just let the Lifespan Respite grantees and partners who are on the call today, I want to let you know that Tawara will be joining us in Albany at the Lifespan Respite Grantee and Partner Learning Symposium so that we can take a deeper dive into how to use the assessment, and we'll also have a chance to interact with her and with each other on the issues that were raised today, if we'd like to dive into those a little bit deeper as well. I also wanted to let you know that we are not printing hard copies of the assessment or the guide. So I would strongly encourage, again, those of you who are coming to our grantee meeting in May, that you take some time to familiarize yourself with the tool and the guide prior to the meeting, or you might want to print out the relevant pages that we'll be talking about and bring them with you. Or if you have your laptops with you, you can bring them to the meeting so that you'll be able to pull up the documents for reference. I didn't know, do you have any closing remarks, Tawara, at all? Again, thank you so much. I'm just so excited about this tool. A first ever self-assessment for a respite organization. So we're really grateful for your work, and we're really excited about seeing you in Albany as well.
Well, I look forward to seeing everyone in Albany, and I just would encourage people to familiarize themselves with the tool, also the guide, and take from it what you need and want. If you've not started this journey again, doesn't mean you have to take every item and on each of the subscales. See what resonates with your programs, see what is going to help make you grow. And most importantly, listen to the voices and experience of people, older adults and persons with disabilities, because that's who we're here to support and serve.
Thank you all. And I hope everyone has a very wonderful afternoon. And thank you again to Wara and
Yeah.
their assistance. Thank you so much.
Thank you.
Bye-bye.
Bye-bye, everyone.